Uh, hi everyone. Thank you for joining us this afternoon for our fifth talk in our mini med school series. Today's talk will be on popular diets. My name is Drew Smith. I'm a UBC medical student in the Island Medical Program in Victoria. So before I move on any further, I'd just like to make a territorial land acknowledgement. I did mention that I'm coming to you from Victoria, so I'd like to acknowledge that I am joining you from the traditional, ancestral, and unceded territory of the Lekwungen-speaking peoples, including the Songhees, Esquimalt, and Wasanich peoples, whose historical relationships with the land continue to this day. So just our typical disclosure slide. I am a medical student, so the talks that we do not constitute for or substitute medical advice. For this talk in particular, I'm going to be providing a background of just a few popular diets. It would be impossible for me to cover all of the different diets there are out there. And as well, I'm just going to be covering some of the evidence around some of the different claims for these diets. I can't cover all of the different claims, whether it's health claims or other things. So I'm just going to be covering some of the main ones where there is some evidence or studies around. And it's not meant to suggest what diet you should be on at all. This talk is just going to be giving you the evidence that's out there, or the things that we know about with these diets, but I'm not going to be suggesting any specific diet at the end of this talk at all. So just providing information generally. And if you do have questions for yourself or your own health, if you have questions about certain things in your nutrition or diet that you want to try out, it's best to talk to your healthcare provider, or a dietitian is also a very good resource as well. While I am on the topic of dietitians, I do just want to quickly mention the difference between a dietitian and a nutritionist. So dietitian is a protected title in Canada. You do have to go through specific training to become a dietitian, and dietitians have a specific title of being a registered dietitian. Whereas nutritionists can go to school to be a nutritionist, but these are typically private schools. It's not a regulated health profession in Canada. So just a little bit of the difference there in terms of the training and qualifications. Dietitians aren't going to be necessarily selling you supplements at natural health food stores. Dietitians are people who are going to be working at community clinics and hospitals, things like that, providing more general sort of health and nutrition advice. And yeah, not really trying to sell you anything like supplements or anything like that. And quickly, I will mention, you heard that this is being recorded. So if you do have to leave at any point, you can do so, and then you will be able to access the recording of this talk on Dr. Gair's website, which I will have a link to, or I have the link to in the email that was sent out. All right, so this is our outline for the talk. As I mentioned, I can't cover every single diet that's out there, so I just picked a few that were that are either quite popular recently or have been popular for a long time. So we're going to be covering the ketogenic diet, which is also known as a very low carbohydrate diet. The Mediterranean diet, which I'm sure you've all heard of before. It's been around for quite a long time. The Paleolithic diet, vegetarian and vegan diet, and then we'll be ending with intermittent fasting, which I know is not a diet. Intermittent fasting is technically just a pattern of eating, but it is something that has been quite popular recently, so I thought it would be good to talk about that a little bit and just mention some of the evidence, or really, as we'll get to, there's not too much evidence around intermittent fasting right now. Okay, so we'll be starting with the ketogenic diet. I'll be giving a bit of background to the ketogenic diet and how it works. And then we'll go into a few different areas where there has been some study around the ketogenic diet. So that includes safety during pregnancy, weight loss and cardiovascular risk factors, and then type 1 and type 2 diabetes. Before we get to that, though, we'll just try to make sure you're all awake and paying attention here when we'll start with a quiz. So I'll get the poll started for this quiz. Just give me a second. Okay. So the question here, which medical condition was the keto diet originally used to help treat? Is it type 2 diabetes, type 1 diabetes, schizophrenia, or epilepsy? So give a little bit of time for people to respond. All right, I think the answers have stopped coming in, so I'll end the poll there and I'll share the results here. All right, so most people were thinking either type 2 or type 1 diabetes. We had one brave person saying epilepsy. Well, that one brave person was actually correct. It is epilepsy, and so I'll be talking about that a little bit more at the beginning here when I go over the background. All right, so there we go. So yes, so the ketogenic diet has actually been around since the early 1900s as a treatment for pediatric epilepsy. And it is still currently being used as a treatment for pediatric epilepsy and as well for adults with epilepsy. It is an alternative to medications. More recently, though, and what you may be more aware of is the use of the ketogenic diet to more manage obesity and type 2 diabetes. I have a red asterisk here just to note that there currently is no evidence-based protocols for using the ketogenic diet to manage obesity and type 2 diabetes. It's just something that's being studied right now, and a lot of people are trying it for managing obesity and type 2 diabetes, but nothing concrete in terms of protocols for using that type of diet. I do want to just briefly mention some of the differences, though, between the uses of the ketogenic diet for pediatric epilepsy as well as other adult epilepsy, and the use that's more common right now, which is for obesity and type 2 diabetes, or just people in general who are wanting to be on a different diet, maybe for a little bit of weight loss. And so the macronutrient ratios are a bit different between these two. As we'll be talking about, the keto diet consists of a large amount of fat, and with treating pediatric epilepsy, the amount of calories that you're supposed to get from fat is very, very high. So about 80 to 90% of your calories are supposed to be from fat. Whereas the more popular use of the ketogenic diet right now, depending on where you look, the numbers are different, but it's about 65 to 80% of the calories are coming from fat, with the remainder of your macronutrients, protein being about 20 to 25%, and then carbohydrates being very low. And so that goes again to say that this is a very low carbohydrate diet. And you might hear, I've got this diagram here just to show what some foods are that are part of our carbohydrates, proteins, and our fats, our main macronutrients. Sometimes you hear about people talking about macros if you are looking at stuff online or social media. Macros is just referring to macronutrients, and these are the three types of macronutrients. So that's what they're referring to if you hear people talking about macros. All right, so what is the purpose of the ketogenic diet? What's it trying to do? So the purpose is basically that you're eating this really, really high amount of fat, really low amount of carbohydrates to essentially shift your body from using glucose as its main energy source to using fat as the main energy source, as well as amino acids But for the most part, it's trying to switch you from glucose to fat. And when your body does get transitioned into this, it's called ketosis. And so again, as I've mentioned, it's a very, very low carbohydrate intake, only about 5 to 10% or 20 to 50 grams per day of carbohydrates. And then most of the rest of what you're getting from in terms of calories is fat and then some protein as well. And it is actually important to limit the protein consumption to maintain this ketosis state. And that'll make a little bit more sense once I kind of go through how this is happening. One thing I do want to mention here, and I'll just put up these photos. So this is kind of what we would want to see people, if they are going to be on a keto diet, this is what you would want to see. This is a healthy keto diet. A lot of people tend to think keto diet, oh, I can be eating basically just nice, big, juicy, fatty steaks for dinner all the time, having greasy bacon. There's this thing called bulletproof coffee where you put butter in your coffee. I think you're supposed to put some other things in it. But this is not a healthy keto diet. This would be a keto diet, but this is not really a healthy keto diet. So just because you're saying you're on the keto diet doesn't necessarily mean it's healthy, because this, I will say, is not very healthy. But this picture here is. So what we're basically, what's different between these two things here is the types of fatty acids you're getting. That's one of the main things. So olive oil, avocado, salmon, you're going to be getting a lot more unsaturated fatty acids. Those are the types of fatty acids that we consider to be more healthy, whereas big fatty steak, bacon, butter, that's saturated fatty acids. And one easy way to remember what the differences between a saturated and unsaturated is just thinking about what is it at room temperature. If it's solid at room temperature, then it's more likely to be a saturated fatty acid. If it's a liquid at room temperature, then it's going to be an unsaturated fatty acid. So olive oil, avocado oil, those are things that are unsaturated fatty acids, whereas butter is a saturated. So if you're going to be on the keto diet, it's probably best to avoid this style of a keto diet. It's better to be eating unsaturated fatty acids in whole foods rather than saturated fatty acids in more processed foods. Okay, so just going more into how exactly this works. So essentially, after about 3 days, and this is just an approximate number, could take a little bit less than this, could take longer than this. But after about 3 days of fasting or being on a very low carbohydrate diet, so again, under 50 grams per day of carbohydrates, essentially what your body does is it depletes all of its carbohydrate stores, and it starts to rely on a process called gluconeogenesis for energy. And this is mostly happening in the kidney. So what gluconeogenesis is this big kind of complicated pathway here. But essentially, I'll just point out the important parts. You're going to be using amino acids and other molecules like lactate, and you're converting them back into glucose. So gluconeogenesis is just taking other things, amino acids, lactate, making more glucose to keep burning the glucose off for energy. So when your body starts doing this, you are still using glucose as the main energy source, but you're now breaking down proteins to produce amino acids, and then using those amino acids to make more glucose that you can then burn off for energy. Now, of course, breaking down protein isn't such a great thing. We need proteins for a lot of important things in our body, and of course, our muscles are going to start wasting away if we just keep on breaking down protein. So we don't really want to keep on doing gluconeogenesis. We want to do something else that's going to help preserve our protein. And so what we end up doing is ketogenesis. So this is what our body moves into. And again, I'm going to have some more pictures of some complicated things, but I'll just try to point out the main things that are important in here. So starting right here, this is beta oxidation. So this is basically where we're breaking down fatty acids. So we start out with some fatty acids that we've already broken off of triglycerides. And we're basically going through this complicated series of reactions here and producing this molecule called acetyl-CoA. We can then take that molecule, acetyl-CoA, and go through this process to produce 3 different molecules here. So acetoacetate, D-beta hydroxybutyrate, and acetone. And these 3 molecules are called ketone bodies. So that's essentially ketogenesis. So we're taking fatty acids, breaking them down into acetyl-CoA, and then using those acetyl-CoA molecules to make ketone bodies. But of course, what are we going to do with those ketone bodies? Well, again, I mentioned this is mostly happening in the liver, but other organs like the muscles, the brain, they need glucose, or they need something from the pathway of breaking down glucose. So what can be done is that these ketone bodies here can be sent to organs like the brain and the muscles, and the acetyl-CoA, and the ketone bodies can be converted back into acetyl-CoA. Then the acetyl-CoA can go through another process called the Krebs cycle or citric acid cycle or TCA cycle. It's got 3 different names just to confuse people. Goes through this process, produces these molecules here that are kind of in these red boxes, NADH and FADH2. Those will go through another process that I won't show because it's just getting a bit too complicated at this point. And anyways, they'll produce more energy. So that's essentially how this works. We are now, instead of breaking down glucose to produce energy or making glucose from amino acids to produce energy and then breaking that down to produce energy, we're breaking down fatty acids. We're producing these molecules called ketone bodies, send those ketone bodies up to the brain or other organs that need energy. These ketone bodies get converted back into acetyl-CoA in those organs, and then the acetyl-CoA can continue going through a process to eventually produce energy. So I hope that sort of makes sense, but that's sort of what ketogenesis is, and that's how we're getting energy from these ketone bodies that we're producing. These 3 ketone bodies are produced at different levels, and they can be excreted in different ways. Acetone, actually, interestingly, basically gets breathed back out for the most part. It also goes into the urine. Yeah, if you are on the keto diet, one side effect is that your breath can start to smell a bit like nail polish, and that's because of the acetone that you're breathing out. So that's sort of an unfortunate thing that can happen with being on the keto diet. Okay, so we've kind of covered what ketogenesis is and what we're trying to do with the keto diet. So now we're just going to go into a few different topics of study on the keto diet. So one big area of study is the use of the keto diet during pregnancy. So I mentioned before that the keto diet can be a non-pharmacologic alternative to anti-epileptic drugs. And anti-epileptic drugs are things that we don't really want to use during pregnancy. So if, say, a woman has a seizure disorder, she's on anti-epileptic medications, and then she's wanting to get pregnant, typically we would recommend either stopping it, whatever anti-epileptic they're on, or we're going to really try to limit it because anti-epileptics can cause congenital malformations, one of which is spina bifida, something I talked about in my previous talk back in November, end of November. So this is one of the congenital malformations that anti-epileptics can cause. So we really want to try to avoid using anti-epileptics. So the thought is, well, if the keto diet is a non-pharmacologic alternative to using anti-epileptic drugs, why not use the keto diet while pregnant so that we can just totally avoid the use of anti-epileptic drugs and hopefully avoid any congenital malformations. So the unfortunate thing, though, is we don't really know if the keto diet is all that safe in pregnancy. There has been studies done, but so far we haven't really established that the keto diet is safe to use in pregnancy. For example, there have been some rodent studies that have been done that have found potential cognitive or functional deficits in the offspring. But of course, those are rodent studies, so not applicable to humans necessarily. So definitely there's a lot more research that needs to be done in this, but it is an interesting area. And it would be obviously really great if we could avoid those anti-epileptic drugs during pregnancy. So moving on to weight loss and cardiovascular risk factors. Weight loss is something I'm sure you've all heard before as sort of a main claim for the ketogenic diet. And from what we have in the literature right now, it seems like in the short term, so while being on the keto diet for under 6 months, it does seem like the keto diet increases weight loss compared to other diets that are lower in fat. But the thing is that we find by the time you're getting to about 6 to 12 months of being in the keto diet versus another diet, a low fat diet, there isn't really much difference in the weight loss that's achieved. So, you know, maybe in the short term, you could go on the keto diet to lose some weight, but then really, it doesn't really matter if you're on the keto diet or some other low fat diet in terms of weight loss. In terms of some cardiovascular risk factors, so I've just got an image here showing some of the modifiable cardiovascular risk factors here. Lipids is, of course, one big risk factor for cardiovascular disease. So we like to see increases in HDL cholesterol, which is our sort of good cholesterol. And we do see with the keto diet that there is an increase in that HDL cholesterol. We also see a decrease in triglycerides, which is also good. The unfortunate thing about being on the keto diet is that it can increase the LDL cholesterol or our bad cholesterol. And in some cases, this can be quite extreme. So for people who already have high cholesterol, it's maybe not the best idea to be on the keto diet, or it's certainly something that you would want to speak to your healthcare provider about, and you would want to be monitoring your cholesterol levels while on the keto diet, because these LDL cholesterol levels can get very, very high in some people on the keto diet. In terms of some other cardiovascular risk factors, such as blood pressure, insulin level and sensitivity, and glucose levels, there doesn't really seem to be any difference between being on the keto diet and some type of low-fat diet. So we don't really see much evidence for the keto diet being any better in terms of those risk factors. So one sort of downside in terms of cardiovascular risk factors with being on the keto diet is that we do know about certain foods that are very, very good at being cardioprotective. So we have a lot of evidence for these types of foods, and these are beans, legumes, and whole grains. The unfortunate thing about the keto diet is because of your carbohydrate restrictions, you're very unlikely to eat many or any of these types of foods. So unfortunately, there maybe is some benefits in terms of risk factors, in terms of the lipids, as I was speaking about, but we really are going to be missing these cardioprotective foods that we do know are very helpful for limiting cardiovascular risk factors. So moving on now to type 2 diabetes. And again, I just have a small diagram here just to show the difference here between type 2, type 1. Type 2 diabetes is the version that typically starts with insensitivity to insulin. So the tissues in your body basically stop listening to insulin, and you stop being able to get those tissues to pull glucose out of the blood. So in type 2 diabetes patients who are on the keto diet, for about 3 to 6 months, we find that it may decrease their A1C levels, and A1C is a measurement of glucose in the blood. So we find that being on the keto diet for 3 to 6 months may slightly decrease that value. It may also slightly decrease body mass index, which is just a way of sort of measuring someone's weight, combining it with their height. And we also find that it may decrease their waist circumference compared to another low-fat diet. So those are some potential benefits in that short term of 3 to 6 months. We also find that in the short term, under 6 months, it may reduce people's diabetes medication. So if someone with type 2 diabetes is on a diabetes medication like metformin, in the short term, they may find that they're able to actually decrease the dose of their medication. And this can improve quality of life as well. But you may notice I'm saying only 3 to 6 months, under 6 months. It's found that longer term being on the keto diet, we don't really find that these results sort of stick around. So this is really more short-term effects and not something that we see in the long term. So something else with patients who are type 2 diabetics who are on the keto diet is that they're more likely to experience some mild adverse effects of going onto the keto diet. So you may have heard of this keto flu, and there's various symptoms of the keto flu that people may experience. And so what we find is type 2 diabetes patients tend to experience these, are more likely to experience these symptoms. Thankfully, though, type 2 diabetes patients don't seem to be more likely to experience serious events like hypoglycemia simply from going onto the keto diet, although there's some caveats to that, which I'll talk about on the next slide. And that is if people are on hypoglycemic medications, specifically sulfonylureas or insulin. And so if you remember, or if you attended Julia's talk last weekend on medications, sulfonylureas is this one right here. And essentially what sulfonylureas are doing is producing more insulin secretion. So being on insulin or being on sulfonylureas is fairly similar. You're just increasing the levels of insulin in your body. And so what we find is that type 2 diabetic patients who are on these medications, sulfonylureas or insulin, seem to be at higher risk of hypoglycemia. So glucose monitoring and medication adjustment does need to be happening if some of these people are on a keto diet. Additionally, if you are a type 2 diabetic patient who is on an SGLT2 inhibitor, and again, just a diagram here to remind you of what the SGLT2 inhibitors do. Essentially, they're working in the kidneys to prevent reabsorption of glucose, and so you just end up peeing out more glucose in the urine. What we find is that with diabetic patients on SGLT2 inhibitors, they are at higher risk of something called ketoacidosis. So something I didn't mention before when I was talking about the ketone bodies is that they are acidic molecules. And if they get to very high levels in the blood, you end up going into something called ketoacidosis. And there's various things that can happen with ketoacidosis. What I mentioned on the previous slide here, I'll just go back real quick. Some of these symptoms here are some symptoms that you can experience with ketoacidosis. If ketoacidosis is more severe or it doesn't really get treated, it can start causing respiratory problems. So people start having respiratory distress as their body is trying to deal with the acidotic state of their blood. So for patients who are type 2 diabetics on these medications, there is a lot of monitoring that does need to be done. So now moving on to type 1 diabetes, and again, just putting in this diagram here. So type 1 diabetes is the form of diabetes in which the pancreas simply isn't producing enough insulin. And there's not a whole lot of information out there, a whole lot of studies out there on type 1 diabetic patients being on the keto diet. But what Diabetes Canada does say right now is that the keto diet is an option that may reduce A1C levels. Again, that's the measurement of glucose in the blood. And it may provide a low glucose variability. But right now, there's not much evidence out there, and the evidence that is out there is fairly low quality. So this is just something that Diabetes Canada is saying. It's an option for people to be on the keto diet, but it's definitely not something that they're recommending right now. Okay, a few other considerations around the keto diet. So some positives. In the short term, it is found that people have an easier time to reduce their food intake, and this is because of appetite control. So there are studies that do show reducing carbohydrates in your diet does allow for better appetite control. And of course, the keto diet is a very low carbohydrate diet, so people do find that they have better appetite control. This is more in the short term though, again, under 6 months. As well, with people consuming less carbohydrates in their diet, it is found that people tend to eat fewer foods high in added sugars, like these tasty looking donuts right here, as well as ultra processed foods such as things like Pop-Tarts. And that sort of makes sense. If you're really restricting your carbohydrate levels to a very, very small amount, you're probably not going to be eating a lot of sugary processed foods like this. So that is a good thing about the keto diet, is that people tend to be really cutting out these high sugar, ultra processed foods. There are some negatives though, some additional negatives though to the keto diet. There are studies that show long-term consumption of extreme carbohydrate intake. So whether you're having a very, very low carbohydrate intake, like in the keto diet, or if you're on some diet where you're having extremely high levels of carbohydrate intake, it is found that doing these things over the long term are associated with higher levels of all-cause cardiovascular and cancer-related mortality. Additionally, with higher carbohydrate restriction, like in the keto diet, where we're really reducing the amount of carbohydrates we're taking in, it is found that people who do this are at a higher risk for poor nutrient uptake, specifically calcium, vitamin D, selenium, magnesium, zinc, and phosphorus. So these are the main nutrients that we find people on the keto diet are sort of missing from their diet. And I just popped in this photo again. In terms of trying to make sure that you're getting these things in your diet, you really want to be eating a lot of these foods. So a lot of certain nuts can have quite a lot of selenium, magnesium, zinc, phosphorus. And yeah, a lot of these foods here can basically get you all of these things. Vitamin D, of course, is a good one that you can just supplement. You can take a supplement for vitamin D. But essentially, if you're following these pictures and eating foods like this, so we're again the unsaturated fatty acids, fish like salmon, and lots of nuts and leafy green vegetables, you're basically going to be covered for these nutrients that tend to be missing in people who are on the keto diet. So it's more going to be those people like I was showing before who are eating a big juicy steak or bacon or the butter and coffee. Those are more the types of people who are going to be missing out on these vitamins. So if you can stick to a healthier keto diet, you should be okay for these nutrients. Okay, so that's it for the keto diet. So now we're going to move on to the Mediterranean diet. Again, I'll just give a brief background to what the Mediterranean diet is, and then we'll talk about evidence surrounding primary and secondary prevention of cardiovascular disease, as well as the use of the Mediterranean diet for weight loss. Okay, so this image here is showing what the Mediterranean diet essentially is. And Mediterranean diet really is more of a lifestyle than just a diet, as this picture shows here. A big part of being on the Mediterranean diet is also being physically active, enjoying meals with other people. So it really is a bit more of a lifestyle than just a diet. But in terms of the dietary parts of the Mediterranean diet, we're eating lots of fruits, vegetables, grains, mostly whole grains. Olive oil is a big component, beans, nuts, legumes, seeds, herbs, and spices. So this is sort of the main thing that you're including in your meals. In terms of other sources of protein, we do have fish and seafood being recommended more so than things like poultry. Also not eating as much eggs, cheese, yogurt, so other dairy products. And we're really trying to limit red meat and sweets. As you'll notice here, main thing in terms of beverage is drinking water. Something that people really do like with the Mediterranean diet is recommended to drink wine. This is obviously an optional thing. You don't have to drink wine as part of the Mediterranean diet, but it is something that people do enjoy about the Mediterranean diet. Is it's actually sort of a recommended part of it to have a glass of red wine with dinners. Okay. So moving on to the first area of study, this is primary prevention for cardiovascular disease. And primary prevention is referring to essentially trying to prevent cardiovascular disease in someone who's either completely healthy or maybe has certain risk factors for cardiovascular disease. So those risk factors that I touched on a little bit earlier, such as high cholesterol, smoking is also a big cardiovascular disease risk factor, diabetes, obesity, those are some other risk factors. So people who are at risk but don't necessarily have cardiovascular disease yet, or healthy individuals, we're trying to prevent them, and that's primary prevention. The cardiovascular diseases, I've just put in this diagram here just to show some of them. Of course, the big ones that people think of are, having a heart attack, having a stroke. Those are sort of the things that we think of with cardiovascular disease. But as this diagram shows here, there's lots of other things that are part of cardiovascular disease. In terms of studies around the Mediterranean diet and trying to prevent cardiovascular disease in healthy or at-risk individuals, the biggest study is called the PREDIMED study. And I won't go into all the details of this study, but it was a very large study that basically was comparing people who are on the Mediterranean diet versus controls. So these controls were people who were essentially just given advice around eating healthy, but weren't necessarily told what exactly they're supposed to eat. The only thing that was controlled in these individuals was they were made to eat a very low amount of saturated fats in their diet. So unsaturated fatty acids were more recommended in these people's diets, and they were limited on their saturated fatty acids. So in this study, they were trying to measure cardiovascular risk, and this was measured by incidence of heart attack, stroke, and death in the people that were part of this study. And what was found was that those who were on the Mediterranean diet experienced a reduction of 30% in these events. So again, heart attack, stroke, and death. And this was mainly led by stroke. So that was the biggest decrease that was seen was incidence of stroke. So that's quite a significant result. And that has led a lot of different groups, including the Canadian Cardiovascular Society, to recommend the Mediterranean diet as a way to lower cardiovascular disease risk as a form of primary prevention again. So this is in people who are healthy or maybe at risk for cardiovascular disease, but don't have cardiovascular disease yet. There are other studies on the Mediterranean diet and trying to look at cardiovascular disease prevention. So some things have looked at, again, these cardiovascular disease risk factors like cholesterol and triglyceride levels. And what has been found is that the Mediterranean diet can slightly reduce the LDL cholesterol or bad cholesterol, as well as triglyceride levels. but there's no real clear effect on the HDL cholesterol or good cholesterol and blood pressure. In terms of secondary prevention of cardiovascular disease, so this is someone who already has cardiovascular disease, so say someone who's already had a heart attack or a stroke or has some other form of cardiovascular disease, and we're trying to prevent any further cardiovascular disease, so another heart attack or another stroke or development of some other cardiovascular disease. And what we see is that there's maybe a reduction of the risk of cardiovascular disease mortality in these people, but we don't really see any other effects. So things like blood pressure and lipid levels, we're not really seeing any effects on those with the Mediterranean diet. So with secondary prevention of cardiovascular disease, the evidence is a little less clear. All right, so now moving on to weight loss. So using the Mediterranean diet for weight loss, we have seen in meta-analyses, which are basically very large studies that take a bunch of different studies and do a bunch of statistics basically on them. And what's been found in these meta-analyses is that if someone's on the Mediterranean diet with a calorie restriction, this is as effective or more effective compared to being on either a low carb or low fat diet with or without calorie restrictions. And this is amongst people who are overweight or obese. So that's another positive of the Mediterranean diet, is that it does seem like it is as good or maybe even better than other diets in terms of weight loss for overweight or obese individuals specifically. Some other positives about the Mediterranean diet, and these are some areas that are fairly new in terms of study and definitely need a lot more study around them. But it has been found that the Mediterranean diet may reduce the risk of both developing type 2 diabetes and improve glucose control for people who already have type 2 diabetes. Additionally, it is found that the Mediterranean diet may delay the development of cognitive disorders such as dementia and Alzheimer's disease. So those are some exciting things in the literature, but certainly they need a lot more study around them. All right, so we've reached our break. So we'll take about a 10-minute break. I think it's 1:50 right now. So we'll come back at about 2 o'clock. So yeah, and if you do have any questions, you can pop them into the chat and we'll do our best to answer them. And so we'll see you at 2 o'clock.
Yeah.
Okay, so
I had a question, but I could not send it.
Okay.
There, but I cannot. How do you send it? Yeah.
You should be able to send it on the chat.
There's no button to say send. No. Okay. Anyhow, I'll ask the question.
You can go ahead and ask your question. Yeah, and I'll do my best to answer it.
Okay. I'm Dr. Raj Prasad. The Mediterranean diet, is it mostly popular in the Italian region of Europe? If it was so useful, why did not become universal? And in United States, is it mostly found in California and Canada, mostly in BC, or you can choose the diet and eat it anywhere?
Yeah, so I mean, yeah, certainly in terms of its origins, the Mediterranean diet, it does originate from the Mediterranean region. So people who live in the Mediterranean region, that's where the diet sort of originates from. I mean, you can be on the Mediterranean diet anywhere. I mean, these days, whatever, as long as you're following sort of the recommended foods like I had in the pyramid there. So, eating lots of vegetables, fruits, whole grains, olive oils, lots of unsaturated fatty acids, and not so much of the saturated, more seafood, fish, that sort of thing. So you can definitely follow the Mediterranean diet wherever you live. But yeah, it did originate from the Mediterranean.
Yeah, but do we have some data? I mean, do we have some scientific data to prove that prolongs longevity prolongs longevity? Do we have some data?
From what I had looked at personally, I didn't see any evidence about longevity necessarily. But not to say that that isn't out there. As I mentioned at the beginning of the talk, I can't cover everything with all of these diets. There's so much information out there. Not all of it is actually based on real scientific evidence. So I don't know the answer to that.
Yeah, because Japanese, they are quite longer lived. But I don't know whether they follow the Mediterranean diet. So anyhow,
yeah, and I mean,
have that perhaps Mediterranean diet is conducive to preventing diseases and hence longevity.
Yeah, well, as I was mentioning there, there is evidence that it does have cardiovascular protective factors, so that certainly can help with longevity. Another thing I will mention, I'll be talking about it when I talk about the Paleolithic diet, which is coming up next year, is that, I mean, diet's only one thing. There's so much other things in life that can help with longevity or make you not live as long. So yeah, diet's only one part, and so.
But I mean, it's considered the effect of epigenetics, I mean, diets can regulate a little bit of longevity too, epigenetics. Yeah, okay.
Yeah, diet can affect epigenetics. Not going to get into that, of course, right now, but yeah, there is evidence about diet and epigenetics. But yeah, not getting into that in this talk.
Okay, thank you.
Yeah, you're welcome. All right, some great questions there. So we'll move on to the next diet here. So as I mentioned, it's the Paleolithic diet. Or you can just call it the Paleo Diet. There's other names. There's like the caveman diet, hunter-gatherer diet. And so I'll talk about the background to this diet. And there's a few different areas of study. So weight loss, waist circumference and fat mass, cardiovascular disease risk factors, glucose tolerance, and satiety. But before we get to that, we'll have another little quiz here. So I'll get the poll ready here. Okay. So the question here is, which type of food are you not supposed to eat while on a paleo diet? Is it grains, red meat, fish, or fruit? And I'll give it a little bit of time for people to respond. All right, looks like we've got a decent amount of people responded, so I'll share the results here. All right, so we've got some people saying grains, some people saying red meat, and a couple of people saying fruit. Okay, so the answer to this one is grains. So grains is something you're not supposed to eat, and I'll talk about that and explain why that is in a minute here. So I'll stop sharing that. Okay, so giving some background to the Paleolithic diet, there's a lot of different information about the different parts of the paleo diet and why exactly you're supposed to eat certain foods and not eat certain foods. So I'm just kind of providing what the basic premise is to the paleo diet. So some of the sort of claims about the diet is that our genetics haven't really changed since the development of agriculture 10,000 years ago. And it's believed amongst the people who are, proponents of this diet, that the modern diet that we eat today is really the big cause of chronic disease, that people who lived during the Paleolithic era didn't have chronic diseases, and it's because of the diets that we eat today that we have all these chronic diseases. So we should just eat like our Paleolithic ancestors did, and if we do that, then we can really limit chronic disease. So that's kind of the basic premise of the diet. In terms of what the diet contains and doesn't contain, it contains meat, fish, vegetables, fruit, and nuts. So you see, oh, oops, sorry, some of those things on the left side of this diagram here. And you're not supposed to eat grains, dairy, sugar, salt, or processed foods. And the idea behind that, again, is that the Paleolithic ancestors didn't have agriculture, so they didn't have grains, they didn't have dairy, they didn't have sugar, salt, or processed foods. So that's sort of the idea, is that that's why you don't eat those things. In terms of what proportions you're supposed to eat of these foods, the meat, fish, vegetables, fruits, and nuts, it varies where you look. I've seen some sources that say you're supposed to eat a lot of meat and fish and smaller amounts of vegetables, fruits, and nuts, and others that say it's mostly vegetables, fruits, and nuts, and small amounts of lean meat and fish. So that sort of varies depending on where you look. Another interesting claim of the proponents of this diet is that legumes are toxic, and so you shouldn't eat those either. So there is a very small amount of truth to that. So legumes do contain things called lectins, and if you eat raw legumes, for example, raw kidney beans, the lectins can make you acutely sick. But the thing is that nobody really eats raw legumes. You cook them, and if you cook them, it basically denatures or destroys the lectin molecules, and legumes aren't toxic. And so I'm sure many of you have eaten legumes and you don't get acutely sick. And legumes have been a staple of many different diets in different areas of the world. So such as South America and Africa, legumes are big parts of the diet, of the traditional diets. And there's no real evidence of them always getting acutely sick. So it's a bit of a weird claim, but they think that, yeah, you shouldn't eat legumes. So again, this is kind of just going to that, and I've already mentioned here, so legumes are fine as long as they're cooked properly, and I just have that legumes diagram here again. One of the things I mentioned is, and again, the proponents of the Paleolithic diet say, oh, don't eat grains because, you know, the Paleolithic ancestors were around before agriculture, so they didn't eat any grains. However, it has been found based on evidence of the findings that they found from the Paleolithic age, is that they actually did eat grains such as wild barley. So that claim is sort of not really true. They did eat grains. Again, it probably depends on what part of the world you're looking at in terms of the Paleolithic ancestors. Maybe some didn't eat grains just based on where they lived, but it has been found, grains have been found in the diets of Paleolithic ancestors. So that claim isn't quite right. And the other claim is about dairy, again, just going back to no agriculture. So not, raising any sort of animals that can produce milk. And so that's why you stay away from dairy products, because our Paleolithic ancestors didn't have that. The evidence against that is that several populations around the world have developed a tolerance for lactose and have been able to continue eating or consuming lactose even into adulthood. So that seems to be some evidence against the fact that, or the claim that Paleolithic ancestors never ate any sort of dairy products. So just a few interesting claims from the people who really follow the whole Paleolithic diet. Some other considerations about this, and this sort of links back to something I was saying just coming back from the break there, is that, diet's only one part of being healthy. And so when they're saying that, Paleolithic ancestors didn't have chronic diseases because they were eating these foods, not the modern diet that we have today, but they also live completely different lives. They lived this hunter-gatherer lifestyle where, they were getting a lot more exercise than the typical person does. today. And so there's a lot less sedentary. We know that having a sedentary lifestyle is a big factor in chronic diseases. The other thing to think about is that the people living at this time had much shorter life expectancies than we do today. So chronic diseases maybe weren't around very much because they simply weren't living long enough for chronic diseases to develop in most people. Another thing is that based on artifacts we've found, such as this statue here, it is possible that obesity existed. They've actually found a lot of statues that have been carved into obese people. So it's thought that, well, if they were carving these, then it must mean that there were people who were around that were obese. So the thought is that obesity probably did exist at this time. So that's just kind of another thing going against the claim that these people had no chronic diseases. So that's a very kind of just brief summary of some of the claims and some of the evidence against those claims with the Paleolithic diet. I put in a link here to an article that kind of goes more in depth into some of the claims and the evidence against those claims. So if you are curious and you want to read more about that, you can access that article when these slides get posted on Dr. Gair's website. And again, the link to that is in the email that was sent out. Okay, so I'll be going into a few different areas of study. Excuse me. But before I get into the different areas of study, I just want to briefly touch on the studies that this evidence comes from. So I'm going to be talking about 5 different areas of study, but they're all coming from only 3 studies with the Paleolithic diet. And I've just summarized what the 3 studies were about. So the first study was comparing people on the Paleo diet to being on the Mediterranean diet. And this is the populations that were in these studies. So in the first one, it was men with ischemic heart disease, obesity, and glucose intolerance. The second study was the Paleo diet versus the diabetic diet. And if you're wondering what the diabetic diet is, like I was when I first read this while I was doing research, the diabetic diet is just a term to refer to like a very healthy diet. So I like to say, think of the Canada Food Guide. This is what the Canada Food Guide recommends in terms of a diet. So lots of fruits, vegetables, whole grains, and basically just whole foods, drinking water as your beverage of choice. And yeah, so it's just a very healthy diet. So the second study was comparing those two in adults with type 2 diabetes. And the third study was comparing the paleo diet versus a low-fat, high-fiber diet in obese postmenopausal women. So the reason why I'm sort of mentioning this and highlighting the people that were in these studies is just to show the great diversity of people that were in these studies, that these 3 studies really can't be generalized to the general population because they do include participants of a very specific group of people. And this is sort of relates to a bigger problem with studying diets. We find that when we try to do studies around diets, it's very difficult. Well, one, it's very difficult for people to be consistent. You know, if you're doing a study and you want people to stay on a specific diet for, 3 months, 6 months, a year, it's very difficult to have all of the participants be consistent and stay on the diet that you want them to stay on. So that can really affect results from diet studies. And as well, again, highlighted by these studies, a lot of times the participants in the studies are not really generalizable to the general public. They can be participants from very specific groups of people. And even when you have multiple studies around a specific diet, such as the paleo diet here, each study can have a completely different group of people in it. And that really affects the results that you get. And so, yeah, so again, this is just relating to a bigger problem with studies around diets. It's just very hard to get consistent evidence. And that's why you may have noticed I'm saying a lot of this diet may have this effect because it's very hard to get sort of concrete, solid evidence from studies around diets. Okay, so moving on to the actual, the evidence around the paleo diet here. So in terms of weight loss, it has been found in the study that was comparing the paleo diet to the diabetic diet, or that kind of Canada Food Guide very healthy diet, that the paleo diet actually did have greater weight loss at up to 3 to 6 months. But then after that, there didn't really seem to be much of a difference in weight loss. When comparing the paleo diet to the low-fat, high-fiber diet, it was found that the paleo diet had greater weight loss at up to 18 months, but by 2 years, there was no difference really. And when it was comparing the paleo diet to the Mediterranean diet, it was found that there was no real difference in weight loss between either diet. So in terms of weight loss, it doesn't seem like the paleo diet is really any better than any other diet that you could go on. Looking specifically at reducing waist circumference and losing fat mass, it was found that there was a lower waist circumference at 3 months when the paleo diet was compared to the Mediterranean and the diabetic diets. And when compared to the low-fat, high-fiber diet, this continued to 6 months, but by 24 months, there was really no difference between the paleo diet and any of these other 3 diets in terms of lowering waist circumference. In terms of fat mass and lean body mass, there was no difference between the paleo diet and the Mediterranean diet. And then comparing the paleo diet to the low-fat, high-fiber diet, it was found that there was greater loss of both fat mass and lean body mass early on, but then by 24 months, there was no real difference. So again, paleo diet doesn't really seem to be much different than these other diets in terms of waist circumference and fat mass reduction. Talking about cardiovascular disease risk factors once again, one thing that has actually been found consistently in these studies is that the paleo diet does seem to be able to decrease triglycerides compared to both the diabetic diet and the low-fat, high-fiber diets. And that was seen at longer times. So not just short-term, but continuing on to 24 months, it was found that the paleo diet was able to decrease triglycerides. However, when looking at other things, there wasn't really much of a difference. So looking at total cholesterol, LDL cholesterol, again, our bad cholesterol, C-reactive protein, which is a general marker of inflammation in the body, as well as systolic blood pressure, which is the bigger number when you're reading a blood pressure. There wasn't really any difference in any of those things when comparing the paleo diet to any of those other diets. And in terms of our HDL cholesterol, our good cholesterol, and diastolic blood pressure, the results from these studies have been quite conflicting. Some of them didn't show a difference, some showed a slight difference, so not really sure what is going on there for those 2 things. In terms of glucose tolerance, it was found when comparing the paleo diet to the Mediterranean diabetic diets that they had similar insulin levels and then conflicting results on being able to control glucose levels. So really not much there. And with comparing the paleo diet to the low-fat, high-fiber diet, there was no difference in insulin levels or glucose control. So again, for glucose tolerance, it doesn't really seem like the paleo diet is much different than these other diets. And finally, for a paleo diet, looking at satiety, so being able to feel full and satisfied after a meal, it was found that people on the paleo diet had higher satiety compared to the diabetic diet, but there was no difference when comparing it to the Mediterranean diet. So again, some evidence, but doesn't really seem that much different from the Mediterranean diet. Okay, so that's it for the Paleolithic diet. So I guess the overall message there is there's some evidence, at least for the reduction of triglycerides, but a lot of other things doesn't really seem much different from other diets, such as the Mediterranean diet. So moving on now to the vegetarian and vegan diets. Again, give a brief background to the vegetarian and vegan diets. Then we'll talk about pregnancy outcomes, life cycle, cancer risk, type 2 diabetes risk, and bone health. Okay, so giving a brief background to these diets, I'm sure you all know what these diets are about. Vegetarian diet is essentially you're not eating any meat, fish, or poultry, and the vegan diet is just a more sort of strict version of the vegetarian diet. So you're not eating any food that comes from animals, and so this includes dairy and eggs. So this picture here, again, very similar to the Mediterranean diet picture I showed earlier. This picture comes from the same group as that Mediterranean photo I showed. And where it's showing that really, it shouldn't just be about the diet. It should be more about a lifestyle of being physically active, cooking and sharing meals with other people. And then again, going into the actual diet, eating lots of fruits and vegetables, whole grains, legumes and seeds, nuts, herbs and spices, unsaturated fatty acids such as like olive oil. And for vegetarians but not vegans, then eating a smaller amount of eggs and dairy products, and water being your main beverage that you should be using. So I put this photo in just to show that it is important to think about when you're going on any of these diets that, again, it's more than just being on the diet. It's about choosing the right foods that you can eat while on that diet, such as the ones in this diagram. Because if you look at this photo here, as long as the patties in this burger are like a Beyond Meat patty, this is actually pretty much a vegetarian or even a vegan diet. But of course, you can tell that this is not very healthy compared to this. So it's just important to think about, just because you're on a vegetarian or vegan diet doesn't necessarily mean it's healthy. It's healthy if you are eating healthy food. So lots of fruits and vegetables, like I've mentioned, whole grains, legumes, nuts, keeping more unsaturated fatty acids rather than saturated fatty acids, and other lifestyle things like being physically active. So that's sort of what you should be focusing on if you are going to go on any of these diets, is eating healthy foods that you can eat while on that diet, rather than just sort of sticking to that diet, because again, this is vegetarian or vegan, but not necessarily healthy. So try to avoid that. All right, so moving on to pregnancy outcomes. So some area of concern around being on a vegetarian or vegan diet is like, okay, well, if someone is pregnant or breastfeeding and they're on a vegetarian or vegan diet, is that going to have any potential negative consequences for the fetus or for the newborn? And what's been found in the evidence is that as long as your vegetarian or vegan diet contains, some good amounts of vegetables, fruit, whole grains, legumes, nuts, and seeds, and you're getting all of the required nutrients you need, which you can do on both vegetarian and vegan diets, then there are no issues with being on one of these diets while being pregnant or while breastfeeding. And furthermore, there's been some specific evidence showing that when comparing vegetarians or vegans versus non-vegetarians, the birth weight of the newborn and the duration of pregnancy is no different. In terms of the nutrients of concern, so if you are on a vegetarian or a vegan diet, there are certain nutrients that are seen quite often to be being deficient. And these are iron, zinc, vitamin B12, and 2 omega-3 fatty acids, DHA and EPA. Just briefly touching on omega-3 fatty acids, these are what they look like. So EPA, DHA, and there's another common one called ALA. Essentially, these are unsaturated, polyunsaturated fatty acids here. The omega-3 is just a specific thing referring to the structure of the chemical, which I don't need to get into how that all works. But anyways, these are polyunsaturated fatty acids, and ALA is something that if you are on a vegetarian or vegan diet, it's actually very easy to get ALA, but the problem is getting EPA and DHA. So for people who are vegetarians, an easy way that you can get the EPA and DHA would be eating things like eggs. So that can provide you these. If you're a vegan, however, there's really low choice or a small amount of choices. The main one I saw that seemed to be a good option, although it seemed a little bit strange, is algae oil. So it appears that algae produces quite large amounts of EPA and DHA. So if you are a vegan, this is probably your best source of getting EPA and DHA. However, the ALA that you can get from lots of other foods, a small amount of this does get converted to EPA and DHA in your body. So the other option for vegans would be, if you're not wanting to be having algae oil in your diet, the other option would just to be making sure that you're eating lots of other foods that have ALA in them, and just eating enough of them that there will be enough converted to EPA and DHA in your body that you'll also be sufficient in those two molecules. In terms of the iron and the zinc and the vitamin B12, some of the things you can get, so spinach and other leafy greens are very high in iron. Nuts are a really great source of zinc. And then vitamin B12 is another one that can be sometimes difficult, especially for vegans, because for vegetarians, you can get vitamin B12 from other things like eggs. But for vegans, this might be a more difficult thing. So vegans typically are going to have like cereals that are fortified with vitamin B12, or be taking vitamin B12 supplements for. Okay. So the next area of study, again, and this is similar to the pregnancy and breastfeeding one, is that there's been a concern around, is a vegetarian or vegan diet appropriate for, say, an infant or for a child to be on? And then, of course, just continuing through childhood and adolescence. And basically, the evidence says the same thing as the slide I was talking about with the pregnancy and breastfeeding, which is that as long as you're getting all of those things in your diet, the vegetables, fruit, nuts, legumes, all those things, you're getting a good amount of the appropriate nutrients. A vegetarian or vegan diet is appropriate for all stages of life. So even for young children and adolescents, it is fine to be on those diets. And furthermore, evidence has shown that there is that being on a vegetarian or vegan diet in childhood doesn't seem to cause any sort of eating disorders in children or adolescents, which has been something that people have wondered or been concerned about. So this one's really interesting. In terms of cancer risk, a meta-analysis has shown that there's about an 8% reduced incidence of total cancer in people who are vegetarian versus non-vegetarian. And if you specifically look at people who are vegan and compare them to non-vegetarians, it's a 15% reduction in total cancer incidence. So of course, this is just talking about cancer incidence in these groups of people. These studies can't really show that like there's any sort of specific causation of the vegetarian or vegan diet specifically preventing cancer. There's can be a lot of other confounding factors to that, but it is an interesting meta-analysis showing that decreased cancer incidence. Specifically, they also looked at they looked at specific cancers and trying to see if there were any specific ones that were reduced. And an interesting thing they found was that if you were a pesco vegetarian, which means you're eating some fish with your vegetarian diet, or if you are a semi-vegetarian, so eating some amount of meat with your vegetarian diet, this seems to specifically lower your risk of colorectal cancer. So that seems to suggest that eating a small amount of fish or meat in those plant-based diets may have some help specifically with colorectal cancer prevention. But again, that's just sort of like an interesting finding and definitely needs more study around it. So now looking at type 2 diabetes risk, it has been found that vegetarians are both at a lower risk of developing type 2 diabetes and have better glucose control, which suggests that the vegetarian diet could be used for both preventing type 2 diabetes and for managing type 2 diabetes. So that's a very good thing if that is true. Again, these are just what we're finding from studies, that there seems to be lower risk and have better control. Yeah, that's a great result. All right, lastly, looking at bone health. I've been talking about a lot of positive things. This is actually kind of one negative thing about being on a vegetarian or vegan diet. It has been found that people who are vegetarian or vegan, and more so for vegans, that they have slightly lower bone mineral densities and higher fracture risks. And this was specifically in people above the age of 50. So the recommendation here is just to ensure that if you are on a vegetarian or vegan diet, trying to get an adequate amount of bone supporting nutrients. And these are the bone supporting nutrients specifically that are can specifically be low in people on a vegetarian or vegan diet. That's calcium, vitamin D, protein, and vitamin B12. In terms of where you can get these things, calcium, again, spinach and other leafy greens have good amounts of calcium in them. Protein, you can find in legumes. And then vitamin B12 or vitamin D, again, is something that you might just, especially for vegans, you might just need to take vitamin D supplements. And vitamin B12, again, for vegans, you might need to be taking or eating cereal that's been fortified with vitamin B12 or being on vitamin B12 supplements. But for vegetarians, you can eat things like eggs to get these vitamins. Okay, so just one final quiz here just to test your knowledge here. I'll get this poll. Okay, so just to see if you're paying attention there. So true or false, a vegan diet should not be adhered to during pregnancy, breastfeeding, or childhood. And I'll give you all a little bit of time to answer. Okay. Give a few more seconds. All right. So most of you got it right there. Yeah, it is false. So vegan diets are totally fine. Again, as long as you're getting the appropriate things in your diet, you're getting all the right amount of nutrients from eating lots of fruits, vegetables, legumes, nuts, all those sorts of things, whole grains. As long as you're eating all those things, you're getting the right amount of nutrients, it's totally fine to be on a vegan diet, whether you're pregnant, breastfeeding, or for a child. All right, so this is the last thing we're going to be covering, intermittent fasting. So as I mentioned before, intermittent fasting isn't a diet per se, it's really just a pattern of eating. So I'll go over the background to intermittent fasting, what it is, and then just talk a bit about what does the evidence say and some questions that are still remaining around this, since this is quite a new area of study, or relatively new area of study. So intermittent fasting, again, I've mentioned it's basically a pattern of eating, and there are many different patterns of intermittent fasting. The 16-8 method is the most common form of intermittent fasting. And as you can see on the diagram here, essentially what you're doing is you do 16 hours of fasting and 8 hours in which you can eat meals. So this diagram here is just showing the feeding period is from 12 p.m. to 8 p.m. And then you're fasting the rest of the time. And during that 8-hour window, you're typically eating about 2 to 3 meals. Now, again, this is just the pattern of eating. It's not necessarily telling you what you should be eating, but it is encouraged, again, to be eating healthy foods during the feeding time. And so this is just another plug for the Canada Food Guide here. So making sure you're eating lots of vegetables and fruits, whole grains, different nuts and legumes as part of protein, along with, red meat and white meat and dairy products. So just trying to make sure you're eating healthy during that feeding time. Of course, if you're fasting for 16 hours and then you spend 8 hours just eating a ton of junk food, then it's probably not going to have any benefits for you. It's probably going to be quite negative for you. So making sure that you're eating healthy foods during that time. One thing, of course, that people struggle with during the fasting is hunger pangs. So it is encouraged to drink coffee, 0-calorie beverages, or just simply water during that time, and that can help with some of the hunger pangs that you will inevitably experience. So what does the evidence say? Well, I mentioned it's a relatively new area of study, so really the evidence doesn't say a whole lot right now because we simply just don't have a lot of evidence out there in the literature yet. In terms of cardiovascular outcomes, there's really a lack of evidence to say anything. Short term, it has been found that there is an improvement in body weight compared to either being on like no treatment or no specific diet. But when comparing doing intermittent fasting to just continuous calorie management, so just daily trying to limit the amount of calories you're taking in, by 3 to 12 months, there's really no difference in body weight. In terms of glucose control, the effect right now is uncertain. So basically, there's not really a whole lot of evidence out there for intermittent fasting right now. It is a current area of study. There are some specific questions around this, aside from sort of health benefits or not having health benefits. There are other questions around intermittent fasting and possible negative effects of it, or just other general questions around it. For example, there are questions around whether or not intermittent fasting can affect someone's well-being. Because you are doing this very strict pattern of eating, it could mean that you're not doing the things that I've already sort of mentioned in terms of like lifestyle things. Eating with family members is an important part of having a healthy diet and healthy lifestyle. And if you're only eating at specific times, that might be limiting you from being able to eat with family members. So could that affect well-being? There's also a question around triggering eating disorders by having this very restricted time in which you are supposed to eat and then fasting for the rest of the day. So that's a question that needs to be studied. And then there's also questions around any of the benefits that have been seen, although minor, do those actually have to do with intermittent fasting, or is this something else going on? So for example, maybe you're someone who likes to have a late night snack, and if you're on intermittent fasting, you're maybe not eating at that time of night anymore. And so the benefits you're seeing isn't necessarily from doing the intermittent fasting, it's simply because you've cut out that midnight snack that you used to have. So just questions around are there other confounding variables that are leading to some of the positive results that have been seen? All right, so that is the end of the talk. thank you for sticking around. And again, apologies for the technical difficulties that we had in the beginning there. We have some helpful resources for you. Again, healthcare provider is a great resource, as well as a dietitian. If you want to speak to a dietitian, you can simply dial 811 and ask to speak to one. Canada Food Guide, as I've already mentioned many times, is a great resource. So Canada Food Guide actually now also is similar to when I was talking about the Mediterranean diet and the vegan and vegetarian diets, in terms of Canada Food Guide's also recommending the whole lifestyle aspect, being active, eating food with other people, along with that sort of plate photo that I was showing before. Other good resources for this information, HealthLink BC is a good one. Unlockfood.ca is a website that's been created by Dietitians of Canada. So it's a great resource if you want to take a look at that. Where I got a lot of the information for this talk is from a website called Practice-Based Evidence in Nutrition. I put a link in here. Unfortunately, this is a website that is restricted to people who have permission through, whether it's through university. So for me, I was able to access it as a UBC student, or if you're a dietitian or other healthcare professional, you can get access to this website. Otherwise, I believe you would probably have to pay for a subscription to be able to access this website. But I did put it in just in case you want to look at it. You can look at some stuff without having to have special access to it. Diabetes Canada is a good website if you do have diabetes and you want some information around nutrition. They have some great resources there. If you want to learn more about some of the specific biochemical things that I mentioned, such as the Ketogenesis, Stat Pearls on NCBI can give some good information on that. And then, of course, there's always some other general websites you can go to. Mayo Clinic, Cleveland Clinic has some good information on these diets and other diets. I typically just recommend, if you are going to some other websites, try to choose a website that's a .gov or a .org. Those tend to be a little bit more reliable. Future talks, we have another talk next Sunday by Nicole on the biology of stress. And then we have 3 more talks in February. So hope you can make it out for those talks. And yeah, thank you very much for being here. And if there's any questions, I see there's something in the chat here. Okay. All right.
Okay.
Any questions? Oh yeah. Go ahead.
Can I ask a question? Can I ask a question?
Yep.
Okay. Start the video. I cannot start the video, but there is professor at Harvard Medical School, David Sinclair. He has written a book on lifespan, and he emphasizes the role of fasting. It's a very good book. I can show you if you put me on the video. I have it. I can show you. I can't get your. Can I get on your video?
If you want, you could maybe send us an email.
I can show you the book I have here. Okay.
You can put your, can you put your camera on? You could put your camera on and show the book on your camera if you wanted to.
Yeah, I don't know where is the camera. I can't find. I don't know. I'm trying to start video, doesn't allow me. Anyhow, yeah.
Oh, it looks like your video's on now.
Now it's okay. Okay.
Oh, now it's gone.
Oh, well, it's not start video. I don't know. It's what. Anyhow, it's a book called Lifespan by Dr. David Sinclair, and it tells what is the significance of fasting. And there is some hormone or chemical produced which really affects your longevity, prolongs your longevity. Mm-hmm. And there is another book called Happy Vegan by Russell Simmons. And it gives you all the details about being vegan. And the third question is that vegetarian, I come from India. We have Buddhism, Hinduism. You don't kill anything. Most of the people have been vegetarian through centuries, thousands of years. Mm-hmm. And they have fairly good life, apart from some diseases. Otherwise, they've had fairly good longevity, Mm-hmm. So And the other question was this lactose intolerance, no? How come, I mean, there's theory that the lactose intolerance gene jumped from animals like domestic animals to human beings. Otherwise, they were all meat eaters. There was nothing to do with the lactose. But how about our mothers? When you're born out of mother, you drink the mother's milk, it must be containing some lactose, isn't it?
Yeah, so so the whole thing with lactose intolerance is that yes, newborns are able to consume lactose. People who are lactose intolerant, when they're born, they are able to, but then as they get older, they develop an intolerance to it.
Yes.
And so in some proportions of the population,
Yes.
they've actually developed the ability to continue consuming lactose after infancy.
Yeah, unless of course you can use lactase, no lactase, yeah.
Mm.
But our theory was that it's like jumping gene, jumping gene. It jumped, from animals, so domestic animals to human beings. But surely our mothers, when they're lactating, they must be producing some lactose in their breast milk, isn't it?
Yep. Yeah. So yeah, like I said, there is lactose in the milk, in the breast milk, and
Okay.
yeah, all newborns are able to
Yeah.
consume lactose, unless you are born with a specific genetic condition that doesn't allow you to. But typically, yeah, all newborns are allowed to, are able to, but it's just that in a lot of people who are lactose intolerant, after infancy, they become intolerant to lactose.
So what happens if we lose that gene that produces lactose?
Can I just say
Yeah,
really
Dr.
quickly that I'm just going to come in really quick to say that all mammals become lactose intolerant as they get older, all of them. So cows no longer are able to drink even their mother's milk anymore, and neither are lambs. Like, it's just something that develops. We don't lose the gene, we lose the production of that gene through epigenetics.
Okay.
Yeah.
Thank you very much. Okay.
Yes,
Yeah,
thank
no
you
problem.
for just
And,
adding that in, Dr. Gair. Yeah.
Yeah. One more question about these legumes. I mean, we consume so much of legumes, different forms of legumes to get the protein source in India.
Yep.
There's no toxic effect. So I don't know how lectins are going to be produced and toxic.
Yeah. Yeah. So I addressed that a little bit in the talk. Yeah. So that's sort of a claim from the proponents of the Paleolithic diet that legumes are toxic. And yes, if you eat legumes, certain legumes, if you eat them raw and you don't cook them at all, they can cause acute toxicity. But the thing is that pretty much everyone who eats legumes cook them, and that essentially deactivates the lectins. And so it doesn't cause toxicity.
Yeah. And also the factor for longevity depends various factors, the genetics, balanced diet, exercise, reduction of stress, yoga, meditation. There are whole factors that control the longevity,
Yep. Oh yeah, for sure. Yeah, there's a lot that goes into it. So it's not just about diet, and that's why the lifestyle recommendations are a big part of it too.
Okay, thank you very much.
Yep. Thank you for the questions. All right. If there's no other questions, we will end it there. And thank you again for coming out, and hopefully we'll see you next Sunday for Nicole's talk. All right. Have a good rest of your Sunday.